Hi, my name is Anne Chung. I'm one of the rheumatologists here at BJC Health. Today I want to talk a little bit about treatment for rheumatoid arthritis and answer a question I get quite commonly. If I've been diagnosed with rheumatoid arthritis, do I need to be on medications? Now, to answer that question, I want to take one step back and talk a little bit about what rheumatoid arthritis is. So rheumatoid arthritis is an autoimmune disease which affects the joints, where there is unwanted inflammation causing pain, joint swelling, and loss of function. Now, aims of treatment, number one, of course, is to control the acute symptoms in the short term so that the patient can return back to their usual daily lives. However, treatments and use of medications is also very important because unchecked, inflammation can cause, in the longer term, permanent joint damage, which is irreversible. And of course, that leads to morbidity. What we also know now is that unchecked inflammation can increase the patient's overall cardiovascular risk. So for all these reasons, medication is quite important, and of course medication therapy needs to be tailored to the individual patient and used in conjunction with other modalities, including optimization of weight, optimization of physical activity, and other factors used together would help control the disease. So of course, medication therapy needs to be tailored to the individual patient, so it's very important to be assessed to determine the severity of disease so your medication therapy can be optimized.